But what we really need to do is to get more of our seniors vaccinated. You compare across the ages, those above 70 has the lowest first dose and booking rates. It really should be the other way around. We really ought to have them have the highest percentage. We all know they are most vulnerable. And what we have observed in countries with high vaccination rate and have opened up, such as the UK, Israel, US, for example, you do see infections gone up. Infections gone up mostly amongst young people because they are up and about and less vaccinated. But hospitalization and severe illnesses, quite stable, but mostly amongst the old still. Yeah, so I think for countries that have opened up, it does show that those who fall severely ill are still the elderly and the seniors. And the reason is because when high vaccination rules are relaxed, society open up, people move around, and then the old are more likely to be infected as a result. So it's not a matter of the elderly saying that, no, I don't go out, and therefore, no, I'm safe. It's not that at all, because these days when we look at our infections and our cases, many of our infections have actually occurred at home. So it's not really a matter of not going out. Yeah, when society open up, your family members go out and can bring the virus back home. So the seniors must get vaccinated. We will be making a bigger push to reach out to our seniors, knocking on their doors if necessary, and this is the work that we need to do. So any one of us, we know of an elderly, a neighbor or a relative who is still hesitating, please help reach out to them and persuade them. Show them our videos in various languages. Just a short update on vaccine efficacy from data from Singapore. I've been updating this, but data has been further refreshed. In particular, NCID and MOH, they have recently concluded a study of about 1,000 household contacts of COVID cases between September 2020 and end of May 2021. And using their data, they found that effectiveness of vaccination against the Delta variant, regardless of symptoms, is about 69%. So this is effectiveness of protection against infection, 69%. So this is quite consistent with other international observations. Recently, there's a reported figure from Israel that Pfizer vaccine efficacy against infection is 64%. So ours registered at 69, so it's roughly that. And this data will be submitted for international publication. It's Singapore's contribution to the understanding of the Delta variant and the vaccines. As for protection against severe illnesses, our data show that protection against symptomatic disease is between 80 and 90%. Effectiveness of vaccination against severe COVID disease requiring oxygen supplementation, ICU care, or death is at 93%. So amongst the local cases reported since 11th of April, only 1% of those vaccinated require oxygen, and none were admitted to ICU. Compared to the unvaccinated cases who develop severe illnesses, the percentage is 10%. Yeah, so it's 1% versus 10%. Now, this is an important point next. With 2/3 of our population now having done the first dose, I think in the coming days or 1 or 2 weeks, we will pretty much saturate our coverage of first doses, and which means our objective of covering or giving as many of our people as possible good protection, that objective would have been achieved. So we will now have to urge individuals to rebook your second dose appointments earlier, because your second dose appointment might be in August. Rebook them earlier so that the interval between first and second doses is 4 weeks instead of 6 to 8 weeks. We are not constrained by supplies anymore, and in fact, we have capacity to deliver more dosages. So remember, the earlier you can get your 2 doses, the better the protection against severe illnesses. A UK study recently showed, a recent UK study showed that against the Delta variant, vaccine protection from symptomatic disease is 35% if it's 1 dose, 79% if it's 2 doses. So get your 2 doses, you'll get better protection earlier. We have been sending out SMSs to those with later appointments to ask them to move forward. 131,000 have moved forward their appointments. There's another 200,000 or so outstanding. We hope they will rebook soon. So help us reach out to them and ask them to rebook their appointments, get themselves protected early. All eligible individuals in Singapore are now already offered vaccination. Everyone has been offered, so long as you are eligible. So at current rate of vaccination, we expect 50% of our population to have received 2 doses of vaccines around the week of 26 July. That means around the starting of the 4th week of July, we would have achieved 50% of our population having received 2 doses. By then, that is an important milestone, and I think we can open up even further. And with good vaccine coverage, from a public health point of view, we can also allow the vaccinated individuals to participate in more community and economic activities once we reach that 50% mark, because they are less likely to be infected and therefore less likely also to cause disease transmission. So, and it is also better if you are not vaccinated, unvaccinated, not to be part of such larger gatherings in order to better protect yourselves. So we are planning for vaccinated individuals when we reach the 50% milestone to be able to dine in bigger groups and to take part in bigger events if they are all vaccinated. And that includes participating in events, settings such as religious services. So Minister Lawrence Wong will speak about this in greater detail in a short while. And also when we reach 50% milestone, 50% 2 doses milestone, it will also be timely for us to have a more definitive roadmap. As of now, I think our coverage is still close to 40% 2 doses, so I think we are still cautious. But once we reach 50%, it will be timely for us to have a more definitive roadmap to transit towards endemic COVID. The transition, you know our style, will never be a big bang. Our approach is always do in steps, do in phases, in a safe, in a cautious way. Yeah, and it will not just be about SMM measures, not about safe management measures, as the co-chairs have explained in the article that was published last week. It must cover other aspects, such as our health protocols, how we report cases, what are the travel arrangements, overseas travel arrangements. So the MTF is working on this, and details will be announced when ready.